Next on the agenda is the vet portion, care for the performance horse. Dr. Mitchell Downey and Dr. Kathleen McMillan are going to speak on respiratory management of the equine performance athlete. So Dr. Mitchell Downey.
Thanks, Jeff. I'd like to welcome you all to the Atlantic Symposium 2011. It gives me esteemed pleasure to introduce Dr. Kathleen McMillan, who's a good friend of mine and an associate professor at the Atlantic Veterinary College in PEI. Kathleen has a master's in veterinary physiology, graduated in 2001, and has 10 years of clinical experience. And there's myself, who graduated in 05, and I see a classmate of mine sitting way over in the corner there, who, had I known Dr. Dickey was going to be here, she could have been sitting up here with us. Own a couple of hospitals here in the St. John region, and currently practicing equine medicine surgery as well as companion animal medicine. So our topic for discussion today is inflammatory airway disease. And this is very commonly seen at our tracks, and not only in the standardbred discipline, but also thoroughbred, dressage, and pretty much any other discipline that is working young horses. In general, IAD, or inflammatory airway disease, is a non-infectious, inflammatory, obstructive airway disease, and it's typically seen again in younger horses. It's started or initiated by inhaling organic dust particles, air pollutants, ammonia viruses, and these are causing an allergic reaction deep in the chest. This disease can cause a wide range of clinical signs, and at this stage we do not know the genetic susceptibility, so we're not sure if there is a genetic link between sires and dams passing this on. Clinical signs. We all want to be the guy on the far right, not the guy on the left. So changes in performance. Our racehorses tend to slow or tire late in the race, and this is commonly seen, and we'll explain this as to why this occurs. Your sport horses tend to be sluggish, unwilling to move forward, and dressage horses oftentimes resist collection. So what's happening? Now, the slide before you, well, okay, there we go. The slide before you shows normal horse on the left and an abnormal histology section on the right. Basically what I want you to take from this is, on the left you can see how open, clean the lung tissue looks. On the right you can see how full of mucus it is. And that's what's happening deep at the cellular level, or deep in the chest of our performance horses. So how does this happen? How does poor performance, how do allergens that we inhale equal poor performance? Basically, what happens is when our athletes are breathing in this dust, mold, spores from their environment, it's causing airway inflammation, and that's a broad characterization of it. There's many steps, many pathways that are occurring that we don't need to talk about today, but basically what you got to get from it is that there's airway inflammation, and this airway inflammation is causing restriction of airflow. And when you have a restriction of airflow, you get less alveoli filling, so less oxygen exchange is occurring, and oxygen is critical. The old adage, no feet, no horse, no air, no horse. And so when you can't get enough oxygen, it oftentimes affects your poor performance late in the mile. The greater the imbalance for oxygen consumption, so going your 58 miles, going your fast trips, that's when your oxygen consumption is really high. And so the greater the imbalance, the poorer the performance. Keeps jumping ahead. some of these clinical signs that may or may not be present, and the reason that this disease can sometimes be overlooked is that sometimes there aren't any signs that go with this. But oftentimes there's a cough, and usually right after exercise you'll hear 2, maybe 3 deep coughs. Sometimes at rest, particularly after you feed hay. Nasal discharge is oftentimes present with this disease, and it can occur as colorless discharge early in the disease to a thick white discharge that can occur late stage of this disease. Some behavioral changes can occur. Horses might seem a little more lethargic. Diagnosis. So how do we find this? Typically through careful examination of history, listening to trainers talk about where they feel, or drivers talk about where they feel their horse is performing the worst. And usually it's late in the mile. That's when everything's on the line. So your history, your clinical signs, but again, they can be vague. And so oftentimes racetrack practitioners are required to do an endoscopy, so scoping horses. And this can be variable. If you catch a horse at rest, he races on Saturday and you scope him on Monday, you might not find too much. And so sometimes we have to scope them within a short window after they perform maximally either training, sometimes jogging, or certainly racing to get a full appreciation for the amount of mucus, the amount of inflammation, and if there's any presence of blood as well. 2 other tests that can be used to diagnose IAD. BALs are more commonly done now in the field setting than they probably were 10, 15 years ago, and so what that entails, we'll talk about that in a second, but it's a bronchoalveolar lavage, so a washing of the lung tissue to assess the types of cells that we find and get a diagnosis based on that. And also pulmonary function tests, we'll touch on that in a second as well. So BAL, commonly called a BAL, bronchoalveolar lavage, consists of usually taking your horse and sedating them, because we are passing a tube deep into their chest. And what we do is collect a sample of fluid from the chest and send that away to a lab. And the characteristic or the diagnostics that occur that reflect inflammatory airway disease are listed there. 5% neutrophils. This is just academic for your veterinarian to look at, but that gives you an appreciation. Neutrophils are typically involved in bacterial infection. Mast cells almost always are related to the allergy cycle, and so eosinophils can be parasitic or allergic in nature as well. The pulmonary function test is one that is typically done in the academic setting. Dr. Wichtel, who we will thank later for providing us with some of this information. Dr. Maureen Wichtel is an internal medicine specialist at the Atlantic Veterinary College in Charlottetown, and Maureen has devoted quite a bit of her time in the last little while to doing research into inflammatory airway disease, trying to come up with, I guess, a better demographic of how widespread this disease is. And this particular test, the histamine challenge test, is one that she will do in conjunction with a barrage of tests. Basically, right now she's offering a $500 workup to trainers in the Maritimes who are willing to take their horse over there for no charge. And this, the PFT, or the histamine challenge test, is one that she will do in conjunction with a BAL, bronchoalveolar lavage, and a transtracheal wash. And basically all we need to concern ourselves with is that this is a measure of airway response, and it helps to tell us how much airflow is occurring in response to an allergen. This is a picture of a horse that's having a pulmonary function test done at the college. And now I'm going to turn it over to Dr. McMillan, who's going to discuss the treatment of IAD.
Thank you very much for having me today. I apologize for my voice. I'm just kind of getting over the virus myself, so if anybody has a hard time understanding me, please let me know. Basically, the goal of treatment for inflammatory airway disease, the primary goal is simply to reverse the signs of the disease. And it can be broken down into 3 phases. The first would be the relief of the acute signs. Second would be institution of treatment for anti-inflammatory. And the third goal would be to try to achieve and maintain some form of long-term control for these horses that perhaps may do very well with the initial stages of treatment, but then after a period of time tend to fall back with the same symptoms that they had been presented with in the first place. The treatment protocols can be dictated by not just the severity of the symptoms that the horse is presented with, but also, as Mitchell discussed, with the results of the BAL test. That also can perhaps give you an indication just how severe the disease is and which direction of treatment or how aggressive you need to treat that horse in order to resolve the symptoms that the horse is presently having. One of the best ways to relieve the initial signs would be to use bronchodilators. That will actually open up the airways and allow the horse to breathe more effectively. Another benefit of this is that the horse can actually continue to keep working when they're not having the bronchospasms that they're having when they're having acute flare-ups. So that is one of the initial goals of using bronchodilators, is to simply open up the airways so the horse can breathe better. Some bronchodilators that we currently use, one that I use most commonly is probably Venipullmin or clenbuterol. Other ones would be aminophylline, albuterol, salbutamol. Those are other drugs, but the most common one I think that most people would have in their barns would be the clenbuterol or Venipullmin. And that can come in injectable as well as an oral suspension. When you read the literature, some people don't even think the bronchodilators are actually necessary and for initial treatment, but I think that really depends on the horse and how severe they are. If they're coughing a lot, when they're eating, when they're exercising, then it can be very beneficial for them to have the bronchodilators so that it can settle down, and then I think that helps to allow for the steroids to come in and do their job a little more effectively. Some people also believe that it stresses the horse out when they're coughing a lot, and that can not only impair their performance, but it can actually perhaps decrease their quality of life at the current time. So they feel that there is a welfare component to that as well. One concern that we have, especially with racehorses, is that bronchodilators are actually considered performance enhancing. So they do tend to have longer drug withdrawals for the clenbuterol, but some of the puffers have more like a 24-hour drug withdrawal, so that can be easier to incorporate into perhaps a racing program. And when we talk about horses that have heaves versus inflammatory airway disease, in those horses their symptoms tend to be a lot more severe, and they certainly do benefit from immediate use with the bronchodilators. The next phase would be anti-inflammatory treatment, and we want to try to reverse the inflammatory cascade. Has anyone ever seen that, I think the Advair commercial, where asthma, it's a kind of a twofold disease where you have the airway inflammation, which leads to the restriction of the airway. So the steroids are probably the best drug that can be used to reduce that inflammation in the lungs. Other treatments that have been used have been oral interferon, and I have had some very good success with that. But if a horse is having a more severe episode, then I find that these steroids do tend to work more effectively. And generally, you need to look at a 2 to 4 week course of these steroids, and they can be given either intramuscularly in the vein or orally. Two of the steroids that we tend to use quite a bit would be dexamethasone and prednisolone. Research indicates that the actual prednisone tablets are less effective than prednisolone, so we try to use that drug instead of the prednisone. Another possible route of treatment would be using puffers or the inhaled steroids, and they can be very beneficial in that you can still get a fairly high dose of the effective steroid in the lungs when using the puffers, and you don't tend to get as much spillover of the steroid into the circulatory system or into the blood that you would get with perhaps the oral or the injectable forms. This can be helpful to perhaps decrease your risk of developing laminitis if you're perhaps using a higher dose of steroid. And another thing with the puffers, they tend to be not quite as spread systemically, so you're not going to have as much immunosuppression or adrenal suppression, so that the horse doesn't tend to have as many more systemic signs of that. And the goal of the steroids is that you don't have to keep them on, hopefully, for a long term, but over that 2 to 4 weeks, you'll start with a higher initial dose, and over that time, you'll decrease your dose so that you have a tapering treatment. It's also important to note that viral and bacterial infections can also kind of stimulate the inflammatory air disease from having more serious flare-ups. So if you do have a horse that perhaps has a bacterial infection, then it is important that you actually get that infection under control first with antibiotics, and they may need to be treated for 7 to 10 days or whatever period of time it takes for the symptoms to stop, and so that you can institute the steroid treatment. The third phase is the long-term management, or as we like to call, environmental control. And it's often the most important because it can be, you can do environmental changes for the horse to minimize his exposure to dust and perhaps whatever allergens or irritants are in the horse's environment that's maybe causing these flare-ups to happen. And also with environmental changes, you don't need to hopefully use as many drugs in your treatment protocol. So one thing that is always a strong debate is the use of straw. You know, a lot of these horses that are allergy prone or really irritated by their environment do tend to do better when they're not on straw. I'm not saying that you can't get really nice straw, but a lot of the straw that we get, whether it gets a little moldy or dusty, it certainly can cause a lot of irritation to these horses. So other forms of bedding could be, for instance, sawdust, shavings, although with shavings you do have to be careful as well. I find they sometimes can be very dusty. A lot of people use peat moss. With peat moss, I find you do have to keep it damp, keep it wet, because on BAL you can actually see little pieces of peat moss in there too. So if the peat moss is dusty, then the horse will actually inhale that, and that can be just as irritating as perhaps the dust in the straw. The other thing you can do is wet down your hay. For a lot of horses that may not be enough, so you may want to actually consider soaking your hay maybe for an hour or so, even in a Rubbermaid tub before you go to feed the horse. That way it will reduce the spores, mold, the dust, everything hopefully in the hay, and will be less irritating for the horse. Some people find that even oats can be a little dusty, so they may want to switch to perhaps a pellet or a complete feed. And if a horse is having a real hard time with hay, then you may want to consider switching to alfalfa cubes, or perhaps haylage has been a good substitution in the last number of years as well. Another predisposing factor for having inflammatory airway disease seems to be horses spending a lot of time in the stable. If the stable is the primary source for the environmental irritants, then it would make sense for the horse to be outside as much as possible. That's really difficult for horses that are stable at the racetrack, because most people don't have the luxury of having turnout facilities for their horses. So perhaps horses that are stabled on farm tracks or at training centers, the more time they can spend outside, the better. And the other thing, you know, this is perhaps more for horses that are riding horses that are stabled next to an arena. If there's a lot of activity in the arena, then there's going to be a lot of dust generated by those horses. Or even the stables that are in close proximity to the racetrack, you can always see a wall of dust just kind of wafting through the stable yard. So that is another source of irritation for the horses. Another thing that you can do is something as simple as just wetting down the alleyway before you sweep. Sounds simple, but sometimes it's easy enough to forget until you see a big cloud of dust in the middle of the alleyway. Blowers, while they are very quick and effective at blowing all the dirt to one end of the barn, actually will really stir everything up and into the environment, so the horse is going to be inhaling a lot of the dust. One person said that when you're mixing up the straw in the stall, you don't want to try to fluff it up too much, because that will actually generate more dust from the straw as well. And it's best if you do have a facility where you can store the hay away from the horses, especially trying not to keep the hay directly above the horses, and then when you're throwing down hay all the time, that also is going to generate more dust. So we're just going to talk a little bit about heaves versus inflammatory airway disease. Sometimes it can be difficult to differentiate the two. When you have a horse that's coughing all the time and it sounds like it's coming right from their toes, it certainly can be concerning that perhaps they're developing something a little more serious than just inflammatory airway disease. But basically, both are non-infectious, inflammatory, and obstructive in nature. And they can be long-standing, and both can have bacterial infections that can kind of initiate the inflammatory cascade that can result in flare-ups in either a heavy horse or a horse with inflammatory airway disease. As I mentioned, dust, mold, anything that's in the environment that could be irritating the horse can be a predisposing factor, so you want to try to keep that down as much as possible. And both horses can manifest with cough, exercise intolerance, and can have more mucus coming out of their nose than you would normally like to see. Although I find with horses that actively have heaves, they're going to have certainly much more impressive symptoms than a horse that may just have a mild form of inflammatory airway disease. And both will result in airway hyperreactivity, and that's why we're seeing a lot of the symptoms that we're currently focusing on in the young horses. So heaves versus inflammatory airway disease. In heaves, they tend to be older horses, although that is not certainly across the board. I have had horses as young as 4 years old develop heaves, possibly after something like a bout of shipping fever or pneumonia. That can certainly make them more predisposed. There is some discussion as to whether or not heaves is actually genetic or heritable. And it seems that there maybe are some horses that whether their immune system is maybe just not as competent as another, but they seem to be a little more perhaps susceptible to developing more severe symptoms. Clinical signs seem to be exacerbated by exposure to moldy hay or really dusty hay, dusty straw. And in these horses, the pulmonary function test does not really seem to be necessary to diagnose these horses, as when they're heavy, they tend to develop that heave line or that extra effort that the horse needs in order to expel all the air out of their lungs. And on the lung wash or the BAL, you're going to have a more severe neutrophilic inflammation present on a horse with heaves than you are with a younger horse that maybe has inflammatory airway disease. The inflammatory airway disease horses are going to be more likely to have eosinophils and mast cells, so that is how a BAL can be helpful in trying to distinguish the two if there is any doubt in your veterinarian's mind as to which form of hyperreactivity they're having. And with inflammatory airway disease, it seems to affect the younger horses that we see at the racetrack, 2, 3, and 4-year-olds, although I have had horses as old as 12 years that do seem to have problems with inflammatory airway problems. There doesn't seem to be as much heritability concern with these horses, although I think that kind of goes back to even you know, when you compare humans, why does one person have an allergy to something and another one does not? So I think that's something that they're still kind of debating, and perhaps more research needs to be put into that in the future. And, you know, certainly in the initial stages of inflammatory airway disease, you may not necessarily see much in clinical signs other than a little cough or perhaps some poor performance. So it's nice if we can try to identify these horses as early as possible so that we can nip this in the bud and hopefully get your horse back to performing at the level that you expect the horse to be. So I guess, are there any questions that you have for us?
Any questions out there? Or? I have one just on this treatment. If it's diagnosed, is there like they can't perform at that during this treatment stage, or is it something that they, you know?
The problem with the treatment is that when we use drugs, they have drug withdrawals. So when you institute a protocol, if you're using the Venipullman, then you're looking at a longer drug withdrawal than perhaps some of the steroids. So you're not perhaps getting necessarily the benefit out of the treatment because you have to stop up to 3 days before the race. So, you know, it's nice if maybe you can even institute the protocol for a couple of weeks before the horse races again so that it can really have a good chance to work.
Yeah, treating for 4 days is not going to fix.
Yeah, 4 days is not enough. It really needs to be a longer
Has to be longer term.
commitment.
Is there products on the market that wouldn't be necessarily steroid oriented, or that would pass a test
There
under
are-
racing that?
We have drugs that we use with 24-hour drug withdrawal,
24 hours.
which can be more beneficial. But I think it goes back to trying to, if you can get the inflammation under control early enough, then, you know, you won't need the drugs. So I guess the trick is to try to get it started and get the horse comfortable, get them symptom-free, and then they can perform more effectively.
And in your opinion, and the Maritimes or the horses you guys have treated on an ongoing basis, and just signs, what percentage of racers would you say would be susceptible to this, as far as you know, performance? And I know everybody gets tired at the end of the mile, but
Yeah.
you know, is it
Personally,
common?
I think a lot of our young horses, a lot of them have it.
Yeah.
I don't think maybe we look hard enough sometimes, or I shouldn't say look hard enough, but I think there's more out there than perhaps we're diagnosing.
Yeah.
And it's something really, the last 5 years, it's become
More
more
prominent.
concerning, certainly more research put into it, and more understanding of the disease as well. And I think, from my perspective, if we can nip the inflammatory airway disease in the bud, then hopefully these horses won't progress to horses that perhaps bleed or horses that develop heaves down the road.
Certainly, a lot of the times it can be seasonal too. You know, we tend to see a fair amount of this in the winter as well, because a lot of times the barn doors are closed. Ragweed season, early September, you can rest assured that a lot of state colts get scoped in September and October, and you find a pile of mucus down in their airway, and you know, they race good June, July, and August, and all of a sudden late in the fall it seems to correlate, and depending on what type of stuff is blooming and what they're sensitive to.
Right. Okay. Excellent. Well, that's wonderful, guys, and very interesting. It's scary, the fact that it sometimes doesn't show any signs and you don't know it's happening, and then it may be too late by the time
And
you catch
that's
it.
the problem with the disease, in that sometimes it's already well established before we realize it's even there.
And the result is basically turning into a bleeder for a racehorse.
It certainly can be.
Yeah.
You know, even the healthy horses can bleed, so anybody that does have inflammation in their lungs are certainly more predisposed to bleeding.
Excellent. Well, thank you very much to both Dr. Downey and Dr. McMillan. Wonderful topic and very informative. Next, we're going to have Ann Beaumont, nutritionist from Co-op Atlantic, come up and speak on nutrition and the value of certain minerals and feeds for the performance horse.
Okay, I'm not going to, usually when it comes time to a nutrition talk, it takes me at least 45, 50 minutes to get through just the basic nutrients, but today I was told we're going to kind of go into 15 minutes, and so I'm just going to touch a bit on carbohydrate nutrition, basically because of energy requirements of the performance horse, and we'll touch a little bit on protein. So. There we go. Basically, the wild ancestors of our horse were kind of designed to eat a forage type diet. Probably the most energy they had to expend was to escape a predator. They spent, most of their energy might have been spent kind of all day just moving around a lot just to get enough forage to be in their diet. So they're designed as what they call a hindgut fermenting herbivore. Doesn't sound very fancy, so horse sounds a lot nicer. Basically, forage is what was vital to keep their digestive system working properly, and over time we've had to kind of gear away from that because of the energy or the calories they require for the work we do today with them. But the forages that they ate were just important all-day source of energy. It was digested in the hindgut of the horse, or the large intestine mostly, and produced some energy sources that kept the horse in good shape for what they required for that day. However, nowadays we expect a lot of work out of horses, whether it's harness racing or eventing or any type of activity that requires a lot more calories in their diet. So over time we've had to rely a little bit more on some grain meals. This is both convenient for the horse owner, another way to get energy into the horse with expected energy output, but it's mainly as fuel for their performance. And also the grains that go in there are more energetically efficient for the horse to get calories from, just not what their digestive system was geared for. So basically grain feeding is designed to help meet their demands for their exercise. I'm going to cover a little bit of the digestive system and what parts of what carbohydrates are digested in which part of the digestive system, and kind of to show you that it does take some good management to do this because the horse was designed to eat forage. So we need a lot of grain to get that energy, or a lot of calories to get that energy output, but this can sometimes lead to a starch overload, and especially the way we typically in our lifestyle today, we get to the barn maybe twice a day. This can lead to some metabolic and digestive upsets. So our carbohydrates, I know there's a big thing on carbs even for human diets nowadays, but carbohydrates are basically different types of carbohydrates, but they all come down to be made up of glucose. Glucose gets entered into the bloodstream and utilized as an energy source. However, other types of carbohydrates can get broken down into other ways. So the three main types, hydrolyzable carb group is just basically your sugars and starches, and we're going to get into that a bit. Then there's a group, those are mostly digested more in the small intestine. I know this picture here is not to scale for the intestinal system of the horse, but just looking on the picture here, it seems to be down lower. Then there's a rapidly fermentable group, and those are a group that will still go into the large intestine. They can get fermented fairly rapidly, but they are fermented by bacteria in the digestive system. The only thing is sometimes this type can cause a little bit of an overload to their system and kill off some bacteria that are not so friendly to the digestive system. And then the slowly fermentable group, and these are the carbohydrates that we mostly find in our forages. So our hydrolyzable group is basically, as I mentioned, the sugars and starches that they would be high concentration in grain rations. There are sugars and starches in forages, just a lower percentage. There are sugars and starches in, for example, in beet pulp, in many other different types of feedstuffs, but they're going to be higher in your grains, like your corns and your oats and your barleys, whatever kind of grains. There's even sugars and starches in soybean meal. It's just all a different percentage. They're readily digested in the small intestine, and of course, as soon as they're digested down into glucose molecules, they can go across into the bloodstream. And this will affect insulin peaks after that. As soon as the blood goes in, or the glucose goes into the bloodstream, that's when the horse's insulin levels will respond and increase to try to get to that glucose to move into the body to use as energy source. So it is a very important energy energy fuel, or important fuel for the horse. It's also a substrate for muscle glycogen. So if there's more glucose going into the bloodstream than needed right at that moment, if the horse is not being worked really hard, then that glucose will go in through the liver into the glycogen stores in the body, and that will be called upon later, perhaps when the horse is racing or when it needs to use that energy. The only problem with this, if we get too high blood glucose, we can get into some different metabolic disorders. So any starches that can't get digested in the small intestine, any of these grains, if you fed too big of a grain meal, or too big of a meal at one time with a lot of grain, some of those starches will get pushed into the large intestine and into the cecum and into the colon, and that's when they can cause a problem. Also, fructans, gums, pectins, those are other types of carbohydrates. There's quite a bit of fructans, for example, even in your grass, cool season grasses. So even Timothy, at the right time of the day, early in the morning, they say, and it's even higher, the fructan content. And that's why if a horse is very susceptible to any type of laminitis or any type of problems that they can't digest carbohydrates well, that early morning pastures are probably a little bit better than late afternoon, after the photosynthesis has occurred, that there's more fructans in the pastures. These fructans can also be high in hay as well. Pectins, that's high in beet pulp. However, it doesn't seem to cause as big a problem once it reaches the large intestine. So basically, these carbohydrates are starting to be broken down by the microbes or the bacteria in the hindgut. These are all good bacteria, and you want to keep those bacteria at the right population levels, because if it gets too high of levels of lactic acid and things like that, which can happen if a high starch diet, then that's when you get into some of these good bacteria being killed off by some of the bad bacteria that would try to break down lactic acid. So our slow fermental group are the type that the horse was designed for, and basically when you have excuse me, hay tested, one of the readings they'll take on there will be the NDF, which is a measure of the carbohydrates such as cellulose, hemicellulose, and lignocellulose. Also, it will check for the amount of lignin in the diet. Lignin is not digestible at all. So this is what is needed in that hindgut for microbial fermentation, and the microbes there can produce enzymes called cellulase that will help break down the fiber and the carbohydrates, and they produce volatile fatty acids that are kind of a byproduct of what they use. They don't really need the volatile fatty acids, the microbes, but it's an energy source for the horse. Unfortunately, with the equine athlete, they don't get enough of these volatile fatty acid energy sources for the amount of work that they're going to do for the performance horse. So this is why we do have to require to feed some grains or other higher calorie ingredients. So it's going to take a combination of those different types of carbohydrates to keep the horse healthy. You're going to need enough of those fermentable ones to keep the hindgut healthy and to keep the digestive tract healthy so that the horse operates well. If the hindgut doesn't work well or the digestive tract's upset, you know the horse isn't going to be well. You need enough carbohydrates and of the other two groups to make sure you have enough energy, enough calories so that the horse can do the work that it's expected. So ideally, if you do have to feed more of those calories or the high starch groups, then you need to try to break it out over several small meals per day. That's going to be the most efficient way to make use of the digestive system of the horse, and that they can efficiently get the calories out of that. You should have at least 50% of the diet should be forage. Ideally, the better the quality of the forage, the less grain that you'll have to feed, so there's going to be less risk of those high starch diets being pushed into the large intestine. And there are other ways to try to meet some of those calories, and that is by using other energy sources such as fat. Excuse me. So fats seems to be more prominent now in different equine diets. Basically, it's an energy-dense way of getting the calories up. They're 2¼ times more calories than what carbohydrates would be. So it does allow you to use a lower carb or a lower starch type diet. And this in turn helps to prevent some of the digestive problems that we see with horses or metabolic problems. It also is shown to be as a glycogen sparing effect. In other words, it'll utilize calories from fat and leave more glycogen in the muscles to be called upon when it's needed. This tends to be more beneficial, however, for the endurance type horse, because the horse that's expected to go out and do a really, really quick race, they're not going to call upon the fat stores as quickly as right away. That fat is not effective or efficiently to be digested right away. It has to be, they have to use that glycogen up first. So endurance horses definitely benefit from fat in the diet. And there seems to be more and more research being done on the types of fats too. There's more research being done on omega-3 and omega-6 fats, not so much as just for an energy source, but also for other benefits, whether it's immune, reproductive, or other types of benefits that they're finding from this research. I just have a slide or so on protein. Basically, proteins are made up of chains of amino acids. Different combinations of those amino acids, different lengths and things will affect the type of protein quality that an ingredient has. Proteins are to help build and repair tissue, so it's very important for the equine athlete. Produces enzymes, hormones, and antibodies. The quality of protein is what can make a difference for different types of feedstuffs that you feed. And you can have a 16%, a 14%, a 12% protein ration, different types, but the types of ingredients in there that make up the different amino acids that the horse may require is what is important. There's really only one amino acid that they've shown a requirement for, and that is lysine. They do have needs for other amino acids, but as far as essential in the diet is lysine. Excess protein can be a problem with horses in that, especially a performance horse, a lot of people I think that they need a higher protein diet to get a better response from their equine athlete. That's not necessarily true. If the horse is going to be eating more grain to meet their caloric needs, they usually are getting more of that 12% diet. So you don't need to go to a 16% diet or a 14% diet just because you're racing your horse or working it hard. If you have extremely poor hay, you may need to go to a 14. But seldom is a 16% diet needed for performance type or work. If they're eating enough calories from the grain ration, they will be getting more feed, which means more grams of protein, and they usually meet their needs from that. In most evaluations I do of horse diets, when I will take the forage analysis and plug it in with in a computer program with the hay analysis and the grain analysis and things, protein is always way higher than what the horse will need, sometimes doubled. And people seem to want to try to feed too much. So you don't need that higher protein diet. There are different research results about excess protein. Some will say it's not detrimental. Some reports will show that it does lower the blood pH, and this can be kind of the opposite probably of what you want in a performance horse if you want to prevent into the the whole bicarb issue. That's what they try to do, is keep the blood pH up. This will actually make it a more acid balance. It increases the water needs, and that's to excrete the urea that's produced when excess protein is broken down. So maybe that horse is going to need more water than for just the digestive system instead of other fluid balances in the body. It may also reduce glycogen. There's been studies shown on that too. And that glycogen is used as an energy store for when that horse needs to call on it in activity. These are just suggested feeding levels taken from the nutrient requirements of horses, and they're just based on percentages of the body weight. So a lot of times I'll get phone calls saying, you know, my horse is a little too thin and things, and I'll end up asking them roughly, what does their horse weigh? How much grain are they feeding? A lot of times it's always a coffee can of this or a juice can of that. You need to kind of know a weight so that you can calculate whether or not you're within suggested guidelines. Now these are only guidelines. They're going to vary depending on the metabolic rate of the horse, like just how that horse is, whether it's an easy or hard keeper, the activity level, the forage quality, things like that. And these guidelines are also based on assuming that you also have a feed that's formulated with adequate protein, minerals, vitamins, and things. So that's all I was going to cover today. I'm not going to get into vitamins, minerals, and all the other types of things because that could take another whole hour. Lucky for you. So everybody's probably yawning by now.
Thank you very much, Ann. Very informative. Any questions for the panel here? Add another 30 seconds to Dr. Downey's 30 seconds. So. No, and very informative, guys. A lot of value there for the people in attendance and those watching via the web.